Another throwaway opportunity. What have you wanted to ask a doctor about yourself but have been too embarrassed to ask? I only have one testicle because I lost one of them due to testicular cancer. Are there any major disadvantages of this? I was reading online but there are quite some mixed responses. And also mentally, it just doesn't feel good knowing I only have one ball. The last time I went to the ER with chest pains, the doctor threw a tantrum on me for wasting their time. I'd ask what I did wrong and how I should act the next time it happens. I had my first heart attack at 31, so I'm always a little worried about chest pains. During the 6 years that followed, I visited the ER no more than 2 times for that reason. What a crap doctor. I don't remember a lot of my past, which concerns me that I might have something wrong with my brain. I don't either. I've always assumed it's a byproduct of my traumatic childhood. It stinks though because it's not like I could turn it off once I was in a healthier situation. So now I don't remember my kids' childhoods either. Good thing I took a lot of pictures, I guess. Why do I only get sick on the weekends? I want a sick day when I'm supposed to go to work, not when I can already sleep in and watch cartoons. Just like getting sick before you go on vacation. The stress and adrenaline of the job keeps the symptoms at bay, but it all shows up once you give your body a chance to fix things. Every once in a while, I have a sharp pain in my butthole, like, not the sphincter itself, it's like, deeper. It's been happening for the past few years and I figure it's probably prostate cancer, but I always forget to ask my doc about it. I'm gonna be a statistic. I'm 35, I think I'm too young to worry about it. Seriously, but I need to get checked, anyway. Definitely get it checked out. Prostate cancer is usually slow growing and late onset, but there are other unpleasant causes that need to be ruled out. Best case is proctalgia fugax. 6 weeks ago I hit my head hard enough that I was left with a giant goose egg for a couple of weeks. I went to the hospital and got checked out, and departed with a clean bill of health. I didn't have any of the symptoms of a concussion, or any of the symptoms that they told me to seek medical attention for if they should turn up. But ever since that day, I have had a bowel movement at exactly the same time every day, 9:30 AM. Before then, my bowel movements were a function of input. Exercise or coffee would trigger them. But ever since I hit my head, it happens at 9:30 AM. Every day. If I have coffee at 7 AM, I don't have a bowel movement until 9:30. If I'm still asleep at 9:30, I wake up needing to urgently go to the bathroom. And the weirdest part, when we switched to daylight savings time, my bowel movement continued to happen at 9:30 after the time change. WTF? How did hitting my head make my bowels develop the ability to tell time? Why is one of my pupils bigger than the other at random times? The lack of symmetry drives me crazy. This you should see a doctor or ophthalmologist about, because there are rarer but serious conditions that have this symptom. Where I live, there are good ophthalmologists in some eyeglass stores. A referral isn't needed to make an appointment, and it costs $20.50. Is it normal that my left testicle hangs a little lower than the other two? Wait a minute. Why am I so dang itchy? Anywhere, but mainly my back and legs, and I will scratch so much I bleed. I get terrible hives when I scratch as well, and the worst of it is this horribly intense itchy sensation I get inside of my joints, knees, elbows and spine for the most part. My skin was really itchy for months. Went to the doctor and had 240/140 blood pressure, failed kidneys, and was close to dying. See a doctor, have them draw blood. How often is it okay to forget perfectly normal words? I swear, like once a week I have a sentence like, oh, what's that thing? The place with the clothes rack? Are you trying to say closet? Yeah, closet. So anyway, I'm in my late 20s, and I'm sober most of the times this happens. I used to smoke a lot of weed, and got the occasional concussion growing up, but I've been clean for 2 years and had no recent head injuries. Word finding can happen when stressed, tired, distracted, nervous, etc. Nothing to worry about if you have no other cognitive symptoms. If you do, get napped with a neuropsychologist who may be able to explain it better and run through some tests with you. Honestly, I sometimes worry that I may be in the beginning stages of schizophrenia, but I'm too embarrassed and scared to bring it up and find out for sure. It could also just be my anxiety getting worse, but still not able to bring myself to ask. When I put my arms at my sides, open my mouth and twist my abdomen either way, I make a strange sound out of my mouth that sounds like I'm gasping for air. It's sort of like a faint scraping noise, like two rough fabrics brushing together. I can breathe fine when I do it, but it does move air involuntarily through my mouth. It's weird, but I'm afraid she'd laugh at me if I showed her. How I can do that too. As far as I know, it's normal. It's just cause you're changing the size of your lungs diaphragm when you're moving back and forth, so air gets sucked in, pushed out. 25m overall, very healthy. Recently noticed that I've been urinating an alarming amount of blood, but no discomfort or pain. Went to the doctor and ruled out infection, STDs, kidney stones, etc. He told me to go home and see if it clears up. After about 4-5 days, it did. Last Saturday, I go out drinking with friends as I usually do on Saturday nights, and as of Monday morning, I am urinating blood again. Thinking back, the first time it happened was a couple days after Saturday night out with friends as well. I have actually cut down my usual alcohol intake and stopped drinking during the week, and I'm not drinking any more than usual on the weekends. It's obvious that alcohol is the cause, and I know what I should do, but could there be a more serious problem with my kidneys bladder that I should be worried about? You should definitely follow up with your doctor if you know it's related to alcohol intake. That would likely be a big help to diagnose your problem. I should start getting an annual physical, and I was thinking about asking if I should get a colonoscopy. Colon cancer runs in my mom's side of the family and I'm nearing 40. I dunno. It seems like asking for one makes me want one. I certainly don't want the pre-cleanse or uncomfortable instruments up my butt, but I don't want colon cancer even more. Plus it's considered preventative, so I won't have to pay for it. I've been paying a fortune for insurance premiums. I might as well use it. Doctor here. Colonoscopy starts at 50 or 10 years before your relative's age when they were diagnosed. Hope that helps. I pee at least 15 times a day. I drink a lot of coffee and water, but dang, it seems excessive. Yo dude, you may wanna check with your primary care provider and make sure you don't have the diabetes. Source: nurse. I have these two small weird bumps under my skin. One I've had for about a year, and the other popped up 2 weeks ago. If I squeeze them they don't hurt, but there's a firmness to them, like there's a tiny pebble lying beneath my skin. They're about the size of a pimple, but like they're made of something else. It'd be nice to know what's going on there. I wasn't concerned with one that much, but since a second one has popped up on the same arm, then I start to worry. But it seems silly to go in for such a small thing, so I'm waiting for my yearly exam. Why I am gaining weight so quickly despite eating better and moving more. You don't realize you're eating more calories, even if they're healthier calories. Not particularly embarrassing, but I have this weird bruise on my left ankle and a bunch of bite marks just above them but below my knee. I always thought they were spider bites, however it never got worse or infected, so I never went to see a doctor. Sometimes the bruise bleeds if I scratch it too much, but it's always there. I do a lot of hiking and my left leg has never worn out, so I never thought to diagnose it. The only conflict I've ever had before is that if it's cold outside, my left leg freezes much faster than my right leg. I know self-medicating can have crap results, however I thought it was a result of peripheral artery disease, but I can still walk fine. See a doctor on that. Wounds that do not heal is not good. I'm not embarrassed about asking about any real concerns, only about the little things which might be a waste of his time. Why has my one finger been hurting for the last 3 days straight? Is it normal for non-cancerous moles to lose pigment over time, etc.? I get like that, too. I make a list of all the small nagging issues and my questions and then just go over all of them at one appointment. I get a liquid discharge before a BM that often leaks out and seeps through my pants. It's really embarrassing and unsightly. This has been going on for over a decade, so if it was something truly serious, it probably would have killed me by now. I also have to return to the bathroom within the first 15 minutes after to wipe further. Any ideas as to why this happens? Anal leakage is caused by movement of the colon when the sphincter cannot constrict to prevent it. Had it happened lots before due to laxatives, as it's really the main purpose, I'd start with your primary and then to a gastroenterologist if needed. If they can help me with my hallucinations, I barely ever get them, but when I do they're terrifying. There are also times where for weeks I would continue to have hallucinations for pretty much every day. Tell your doctor, that's not embarrassing, but holy crap, it is not normal either. If I can get an appointment to see if I do have anxiety depression. Speaking as someone who's really been putting it off for too long, definitely try to do so. If there's free services in your area, as a student or something, make it happen. Hugs, pal. Take care of yourself. Can I request for a doctor's letter medical certify miss a day of work school due to period cramps? Because they can get really bad and sometimes causes me to pass out. As far as I know I don't have any illnesses that cause this, but my mom's cramps were pretty bad too, so it's probably just genetics. I have a lot of random muscle movements. A couple times a week I'll get a muscle group in one arm or leg quivering visibly when I'm just sitting there, and a couple times a month I'll have one or more limbs get the urge to move, which rapidly grows to the point that I can't even resist it and they just make one hard jerk and then I'm fine. It is never severe enough to affect driving or anything, and I feel it a few seconds before it becomes uncontrollable so I can avoid hurting myself etc, but it is super weird and has been happening for as long as I can remember. Persisting across changes in diet and environment. Part of me wonders if I have a brain tumor or something, and part of me figures that if I've never had a problem in the 10+ years I know it has been happening, then it isn't worth getting a bunch of tests over. Twitches and spasms along with constant lockups are a sign of a potassium deficiency. Eat a banana or two sometimes. All I know about that. For a long time I didn't mention issues I was having when I was going to sleep. Come to find out I was probably having seizures nightly for about 5 years. I also never wanted to mention my depression issues because I figured that would red flag me to my insurance and company. Both issues are being addressed after both peaked last year. Many years ago I took a massive crap, approx 5.9 Corex, and it did quite a bit of damage on the way out. It took a good month to heal, but it has healed in a way that I have like a small flap of skin on my butthole. Most of the time it's alright, but it can be easily irritated if wiped the wrong way. I fear one day my butt will get infected. I've been getting pain in my chest recently. I'm guessing it's anxiety related because exams are coming up and I'm worried my scholarship won't be renewed because my grades aren't as good as they were last year. I'm scared to ask whether it's something else since chest pain can be serious. Also, because I've got exams, so I don't feel like waiting at a doctor's office and wasting so much time and stressing over results. I have 2 weeks off after exams. I'll do it then. Not really embarrassed, I just can't be bothered to see someone about it, but there's blood in my crap really often. It'll usually be like every few weeks or a week or two straight of every crap being bloody. It's been on and off for a few years now. Until something actually bad comes of it I'll continue to ignore it. Why does my sack get sore after I nut? Please see a doctor. It could be epididymitis, which left untreated can sometimes affect fertility. An ultrasound and urine cultures may be necessary. Not technically an answer to this post, but a bit of a story about when you actually do see your doctor about something you're embarrassed to ask. I was 32 and had recently gained about 40 pounds after an injury that kept me out of the gym. General onset laziness. I also had started smoking more pot than I ever had, every day or two versus at a party every few months. I noticed myself getting super short of breath randomly after little things like walking up small flights of stairs. I figured it was all related to the things mentioned above, but still was surprised how easily winded I was. I asked my doctor and was honest about everything that had changed. He sent me for a bunch of respiratory and cardiological tests. It came back that I was born with a significant heart murmur, bicuspid aortic valve, that's leaking quite a bit. I'm not at the point to need surgery yet, but predictions are that I will within 5 years. Had I not pursued this I'd likely have had a major heart attack around 40 that easily could have killed me. I feel like though it's embarrassing, people need to ask these questions. That's what doctors are here for. I've had my share of uncomfortable conversations at the doctor, but at least I'm informed about my health and body. How to deal with PTSD. I feel like something is wrong, but every time I try to bring it up to my doctor he dismisses me. I've had worsening fatigue and memory loss for the past few years. I always feel like I'm in a cloud. It's gotten to the point now where my memory is so bad I can't remember things that happened even a few minutes ago. I used to have an amazing memory and it's just getting worse and worse. I feel like I'm barely functioning. I've also been getting chest pains for the past few years, which recently has now developed a strange new symptom. My ribs are popping out, like I literally have to push them back in. It's gross. I have no idea if the two are related, but I just feel so hopeless because my doctor just tells me it's in my head and I must be depressed, then tries to give me antidepressants. I've been depressed before. I know what it feels like, and I can say with great certainty I am currently not depressed. A doctor who won't even acknowledge that anything is wrong might not be the best doctor. You might want to find another professional to get you a second opinion. WTF, the black shadows I've been seeing at night are. I think I read somewhere that is just your brain trying to comprehend stuff in the dark, but it just ends up making weird shapes. Take this with a grain of salt, courser, I am not too sure. I guess it's filled with only blood all the time, at least 2 a month, but not more than that many at a time. It's like a blood blister but squishy, and they pop with little pressure but never fully empty. They either stay empty-ish and like a hole in my skin or keep on filling back up. They are filled with black blood or sometimes black mixed with creamy red. I get them different places. When I raced a bicyclette I got them along my thighs. Now I get them randomly in my lower body area in hair follicles. Sometimes they shoot inwards if I try to pop them without a needle. Is dong acne normal? I'm going to give this a yes and a no, not being a doctor. If you're a teenager, or particularly oily, acne can strike anywhere. If you don't clean yourself well, doubly so. It could also just be Fordyce spots, which are harmless and common. If you're only getting it after shaving, don't pick at it. It's just an irritated hair follicle then. I've had these bruises on my legs for going in 5 years now. Is that normal? Don't ask Reddit. Go to the doctor. Honors biology teacher of mine in high school, and I figured out that I could, or my daughter, have Parkinson's because of my grandfather having and passing away from it. Would like to know if there's a way to catch it early and if there's a way to prevent it. There's definitely genetic markers for Huntington's, but they haven't found any predominant ones yet that would be observed on everyone with Parkinson's. When will I start growing? I mean, honestly, why do I have bad breath? I think my tongue is fricked. Yes, I floss. Yes, I brush my tongue. Like, do I need my tonsils removed due to bad breath? I hate it and it cripples me. Can I ask my gastroenterologist to remove an external hemorrhoid when he performs my colonoscopy? My hair is slowly going white and my beard is now slowly becoming ginger. I am 20 years old. Why is this happening to me now? Genetics? Is it okay that my one nipple is so much darker than the other 3? I hear really faint music or radio type sounds sometimes at night. Sometimes it drives me nuts. I will get up and search the house for the sound, but have never found a source. I'm pretty sure it's in my head. Could be tinnitus. 20% of people have it. I basically don't have a short-term memory. It's really annoying. I have to study things like names to remember them. I can't remember conversations at all. Alzheimer's is in our family and I'm so scared this might be early symptoms, especially since I'm still in my 20s. Same thing here. Unfortunately, Alzheimer is a big thing in the family and I haven't had a proper memory in about 3 years. I'm 19 now. Friends will come back to a conversation we had just yesterday and I have no recollection of it whatsoever. Bonus: I can watch a show again and it'll be like seeing it for the first time. About a month or 2 ago there was a week or 2 where every night before I fell asleep I would get incredibly nervous and felt like the universe would explode. I don't know how else to explain it, but I felt like existence would just end for no reason. Basically just a feeling of impending doom, and I couldn't shake that feeling no matter how hard I tried. My head would get really hot but there was no pain. My family has a history of schizophrenia, but luckily it isn't really the same symptoms. Is it just anxiety? It hasn't happened since. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.